Breast cancer touches nearly every family in some way, whether it's a mother, a sister, friend, maybe a coworker. During this Breast Cancer Awareness Month, the focus isn't just on pink ribbons, but on the real people fighting, surviving, and pushing towards a cure. The American Cancer Society says about 1 in 8 women in the U.S. will develop invasive breast cancer in her lifetime, making it the most common cancer among women. Breast cancer remains the second leading cause of cancer death among women, taking about 43,000 lives in the U.S. each year. But when detected early and still localized, breast cancer has a 99% survival rate for 5 years, underscoring the importance of screenings and these conversations. So here to talk more about how we are fighting breast cancer is Dr. Nitika Sharma, medical oncologist and hematologist with City of Hope, Atlanta. Thanks so much for the time.
Thank you so much for having me.
Technology changing quickly. What advancements in treatment are you seeing that are giving patients the best outcomes right now?
The breast cancer treatment breakthroughs and recent developments in research are fueling new ways to assess risk of breast cancer and prevent, detect, diagnose, and treat breast cancer. These new breast cancer treatment breakthroughs are focused on getting more effective drugs out to serve our people. And these drugs do not only specifically target breast cancer cells, but also are aimed to minimize side effects from treatments, as well as prevent breast cancer cells from coming back.
Yeah.
So while some treatments increase the effectiveness of existing drugs, others offer new innovative strategies for attacking tumor cells. The breast cancer treatment is not anymore one size fits all. The breast cancer is a wide umbrella with different types of breast cancer cells underneath, and each type of breast cancer is driven by separate mechanisms of resistance that can develop and the treatments that work for that.
So specialized treatments depending on what stage a woman it is and what cancer you see. The one thing that is pretty universal is this early detection and the need for mammograms, but there has been confusion over the guidelines about what age a woman should start that process. Can you walk us through that?
Absolutely. In general, if the patient does not have any risk factors over the age of 40, the USPSTF, the NCCN guidelines recommend screening for every woman over the age of 40 once a year. So an annual screening mammogram is recommended. However, there are certain high-risk population as well, such as individuals who have gotten radiation treatment for a different cause between the age of 10 and 30 years, individuals with family history of breast cancer, individuals with certain ethnicities such as Ashkenazi Jews may have a higher risk of carrying high-risk mutations such as BRCA mutation. And for those individuals, the screening may be recommended earlier than 40 years.
So those conversations are really important to have with a doctor. Black women in Georgia are often diagnosed at later stages and have higher mortality rates because of some barriers that we're seeing. Can you talk about the barriers and what we need to do to bring those down?
Yes. In general, the breast cancer incidence is higher amongst white women as compared to the Black women. But what is an interesting fact is that the Black women do have a higher risk of mortality when diagnosed with the breast cancer. There still exists a lot of disparity between when it comes to screening, screening itself, the diagnosis, and the research trials. And one of the goals of City of Hope is to work on those, removing those disparities in the diagnosis of breast cancer. The earlier the breast cancer is diagnosed, there is a much higher likelihood of cure. The earlier stage the cancer is, there is much high likelihood of cure and lower risk of the cancer coming back. So the focus of City of Hope is to overcome these barriers that exist between different races.
Yeah, and equity of access and care. quickly, if someone were to think about doing one or two things differently in terms of their lifestyle to try to bring down their risk, quickly, what would that be?
The first and the foremost thing is, go for regular exams, see a doctor regularly and know your baseline.
Okay.
If you notice anything suspicious, don't hesitate to seek care.
Right.
The breast cancer, although is generally more commonly seen in older individuals, but we are seeing more and more cancers in younger individuals less than 40 years of age. So it is a growing epidemic in breast cancer and several other cancers as well.
Yeah.
So do not ignore the symptoms.
All right.
But when it comes to lifestyle modifications, focused on healthy eating, trying to lose weight,
Sure.
unintentional weight gain can be a risk factor itself.
Healthy life and see those doctors. Dr. Sharma, thank you so much. We appreciate the information.
You're very welcome.